Welcome, my name is Salih Yıldırım. I am the Managing Director for ISSCA in Turkey, and I am very happy and privileged to be the host for this training.
Just talk a little bit of the organization. As always, honor Professor Kim from Korea, which is the creator of the ISSCA, which gave us the vision to really create standard and create a network of doctors that can function as a unit that can have unified criteria and how to do things in the regenerative medicine world. So please do take advantage of these 2 days in any way possible. Our instructors are very accessible. Sally and myself are at your disposal.
They will be handing you some bags. In these bags, we have 3 things. One is the embroidered uniforms that we will be wearing in the clinic tomorrow. It's an ISSCA with your name. It's an embroidered uniform. It will be a good memory from this training. And also we have 2 very important publications that are not sold in somewhere else. It's only for our trainees. Our scientific directors worked on in different disciplines, and you will be finding questionnaires, forms, protocols, and treatment plans and patient selection information in these books. And there also you will find the supported articles that why we are using these treatment protocols, and also these are in your bag.
Today is the first day of an intensive 2-day training, and we're focusing on technology. As always, the ISSCA is on the cutting edge of the latest and greatest technologies that can be applied in regenerative medicine point-of-care environment. So we're going to be discussing pure MSCs from perinatal tissue. We're going to be launching our exosome product, both the flow and the lyophilized. We're going to be working with 3D bioprinting, lots of new applications in wound care, diabetes, and other applications as well. And we're going to be focusing, as always, in our tried and true technologies, proven technologies like SVF, BMA, pure PRP. So in general, what we try to do in empowering these doctors is not only teaching them the basic science, not only giving them protocols, but also focusing on the latest technology available so they can get the best results.
Well, before I start my presentation, I just tried to look at this booklet, and I saw that there are a lot of precious information about new guidelines and treatment protocols. I think this is the aim and the privilege, right, of ISSCA. ISSCA's association is very crucial, and then at a time I was telling my colleagues that, look, we're doing this, but we don't have the guidelines. Because when you're doing applications, the story is totally different. As Marita said, it's custom-wise, it's patient-wise, and it needs a lot of clinical experience and feedback that you have to collect. And of course, studies, clinical trials, and then you can initiate the protocols accordingly. And when I looked at the booklet and I saw a couple of guidelines about treatments, I was very happy, and I wish that maybe one day I would be able to put one there as well.
I just finished my lecture, and it was regarding clinical applications of cellular therapies and a little of molecular biology, cellular biology, and general science of stem cells. It was important for physicians not only to know the clinical applications, but to go back to the basic science, to know exactly what cells are we going to use, which cells are supposed to do what is the mechanism of action of the cells, to be able to make strong decisions in terms of therapeutic interventions. We're going to be using using exosomes and platelet-rich plasma for facial injection, acne scarring, and such. So stay with us.